So pardon our pardon our challenges today. Today we're going to be talking about COVID-19. Are we hitting the peak? We've got some upcoming topics that we'll talk about, like what does it look like when we do start getting out into the business world? And again, some of the previous topics we've talked about are ACE receptors, blood pressure medicines, social distancing, herd immunity, and COVID-19 and heart damage, as well as supplements. We will get into some of those discussions in just a minute, right after Carl sets us up with our intro. So thank you, Carl. Again, we're going to be talking about what it looks like in terms of the peak right now, and are we hitting the peak? Before we do, just again, a brief reminder, if there's any generation that needs access to better access to healthcare, it's the baby boomer generation. We are finally starting to get our heads wrapped around remote medicine. Why? Because it's an unusual situation, 100-year pandemic. We're offering telemedicine now, but we're not the only ones. Most of your docs are now probably offering it. We've seen it in the medical communities out there. Ask your doc about things like electronic medical records to make sure that you're getting the improvement in care that you should be getting. Now, Janice, you're going to join us to talk about whether we're hitting a peak or not?
Okay, yes.
So first of all, pardon the technical challenges. We were on with a meeting. I was on with a meeting with the employer I was talking about. For some reason, Google Chrome took me out of everything. It took me out of StreamYard. It took me out of several other places. So what was supposed to work didn't. So if you still made it, if you've been patient with us, thank you so much for putting up with the delay. Now, the big question, you're seeing this in terms of a lot of debate out there right now. The economy versus getting back out there. And what you hear is continued assumptions of, okay, you know what? I want to go back to where I was 6 months ago. Well, in order to go back to where you were 6 months ago, number one, I think we all need to know that's not going to happen anytime soon. Things are going to be different, a lot different. And hopefully we'll have some slides to show a little bit about how different that will be. If not, we'll discuss some of it. But in order to get to that discussion, let's step back even just a little bit further and ask the question, well, where are we? Are we actually at the peak? Are we going on the other side of the peak? Where are we right now? And if you look at some of these numbers, they help provide some introduction to that discussion. Are we hitting the peak? COVID-19 cases hit 2 million as of April 15. The earliest known case was November 17 in 2019. It took 4.5 months to reach 1 million. It only took 2 more weeks to reach 2 million. So just that number in and of yourself does not indicate like that we're headed down the other side of, we've already reached the crest and coming back down. No way. US, Spain, Italy, France, Germany, now UK even have surpassed China. US, as you can see, is what? Way over 3 times the number 2 country, which is now Spain. So in the US, we have more than 600,000 cases, 20% in New York. Total deaths, 26,000. Highest death tally on a daily basis was Tuesday at April 14th at 2,405. So again, I think it's really obvious we're not coming down the global, the other side of that curve.
Well, and we also know this is very incomplete data.
Correct.
We have not done testing except of the sickest people or first responders. So there's a huge gap of information, a huge statistic that is missing. People are found at home dead, how they're being, the cause of death is being labeled. We're not totally sure.
Assumption that it's COVID.
Yeah. And then there was a recent nursing home that had, I think, like 17 dead bodies in fact, that nursing home. So I don't think we're getting the full picture here.
Not at all. And again, I think people need to understand the quality of this data. You hear a lot of folks say, well, somebody's trying to lie, they're being opaque. I'm sure there's a lot of that going on, but the bigger reality is we just don't have the data because it's not out there.
No.
And the data that you have, you've got to look at every different piece of it.
Right.
To your point about a lot of these being the deaths being labeled as COVID, which were just death in the home, I heard at one place that it was most of the deaths right now were at home. Is that correct?
I don't know that statistic.
Okay. Maybe it was most of the deaths did not have a COVID test yet. Again, both of those comments surprised me, and I haven't been able to verify either one of them.
Well, I'm assuming the hospitals have the most reportable statistics on deaths, or like these large metropolitan hospitals.
Well, for sure. And again, you've had a lot of, even to that point, we've had many viewers say, well, the hospital data is suspect. And why are they saying that? Because of the guidance that came out from the CDC saying, well, if you don't know, go ahead and label it as COVID. I don't think that's what they said, but what I think the intent of it was to say, look, you're not going to have complete testing on every one of these cases that comes in. Right. If it walks like a duck, quacks like a duck, call it a duck. We also know something else that you and I discussed the other day. Biologically, a lot of what's going on with COVID deaths is it's creating heart attacks, it's creating deaths in people that were going to be dying over the next couple of years anyway. So what do you call that? Do you call that a heart attack, or do you call that a COVID death? And they're getting labeled as COVID deaths.
Or the other way around, those comorbidities are making people more susceptible to COVID.
Right. So a couple of other facts. Remember, you and I were asking what was IMHE, Institute for, I think, Medical and
it's an Institute of Metrics.
Metrics for Health. And what was it's the group out of University of Washington. Mm-hmm. So this is the University of Washington information. And by the way, sometime next week, we're going to be talking about the models. If you look, for example, and one of the things we'll use is the comparison of the Minnesota model and the University of Washington model. They were off like, I think, a factor of 10. So you begin to ask the question, well, what's going into these models and how can they be that far off, and what's going on? And we'll get into some detail on that, but not today.
And Hopkins has another model as of yesterday.
Yep, they do. And a U.S. model, which goes very granular and down into each county.
Right.
Well, let's go back to the slides here. Washington, New York, New Jersey appear to have already peaked. Now, just that one statement, does that give you any concern to say that?
It doesn't give me any confidence.
Correct. I don't have confidence either. It peaked in terms of what? They clearly have not reached a level of herd immunity. No. So what does that mean when we say these three states have already peaked?
And I think there's a lot of emotion. You mentioned the word lies, and then we're using peaked. there's a lot of emotion, and people are seeking some form of false confidence that they can go back to work, they can resume their daily activities. There's a lot of emotion packed into some of these words.
There really is. There's also this desire. There's a lot of human, just like everything else, the human nature becomes to be a big issue. I can't remember which section it was in which press conference it was. Dr. Burke, who's managing a lot of the projections for the feds, was making the point about, look, we don't expect everybody to follow shelter-in-place guidelines. We hope that they will, but we have an expectation that sometimes people are not going to. And sure enough, you have a big event over the next 2 weeks, we're going to see it in the statistics. So again, that starts to bring up the whole point that it's a naive assumption to assume that the entire country is going to behave the same way.
It's a naive assumption to assume a state's going to behave the same way, or even a pocket. I mean, we've gone through all this thing, have we done Mardi Gras shaming, that they celebrated
Right.
Mardi Gras back in early February, and that was a cause of outbreak. That is still in the news. But even last Sunday, we had people going to church against state recommendations, not even recommendations, really almost like illegal.
So even less than a week ago, we still had large congregations.
So when are those going to peak? Well, there's
over the next week or so.
There's a New Orleans parish that I just read the headline where that pastor, he himself was shopping at Albertsons twice a day, going to get gas, insisting that his church meet. Now his church lawyer has COVID-19, another parishioner has COVID-19, and he's beginning to look back and say, what did I do?
Mm. And you know what? There's 330 million of us here in the U.S. alone.
Right. People are practicing their own forms of physical isolation. So how does that determine, what confidence do we have in a peak?
Right. So, that really does start to bring up the whole point of the question, have we reached the peak? And the answer is, which peak for whom, which state, which church, which community, which family, which individual, and what sort of influence does that individual have on other people in terms of getting them out and getting them into an area where transmission can occur. Now, all of this starts to bring up the next issue of, there are two issues. The first one is, you're talking about human behavior and you're trying to homogenize it through the entire country. Maybe that's not a fair statement. Well, the reality is economics is a human behavior issue as well. And the economists have to do this also. They have to look at a global or even a national economy. So how do they do that?
And public health is human behavior.
Public health is human behavior. So how do we summarize that in one word? I think it's clear, as we were talking this morning, it's not like we have 50 states all going up the ramp on a hockey puck with geometric increases of cases every day now. That's not what we've got going on. In fact, we've got...
And for those of you that do not know the hockey puck analogy, it's an upward trend.
Geometric upward trend.
Yes.
Not a linear upward trend, geometric.
Yeah.
And we do have that in terms of overall cases, month by month globally. We have that month by month here in the U.S. But the question is day by day. And you're now starting to see some of this slowdown. So you do see some light at the end of the tunnel. We've got situations where we've got 3 or 4 big states, Michigan, New York, New Jersey, Washington, who came out early with some problems, Illinois, Chicago. And you're starting to see some light at the end of the tunnel on a couple of those areas. Then you've got 10 to 15 other second-tier states that look like they're coming up, like Colorado, Wyoming,
Idaho.
Yeah, some of them are listed here. So we're not in a situation where we're over the curve. We know that. We're
Right.
clearly not in a situation where we got 50 states going up the curve.
Well, and I just want to mention our own metrics here in Kentucky. One day this week we had 0 deaths and everybody breathed a sigh of relief. Yesterday we had 7 deaths. So it's not a trend.
Yeah,
it's not a set trend. This is going up and down.
It's a little bit choppy right now.
Yeah, it is.
So, Carl, given all of our tech challenges this morning, most of which I caused, let me ask you, do you have those 2 clips available? Carl?
Yeah. The
Tony
one
Fauci, the Dr. Fauci clip and the Dr. Redfield clip.
hold on. Let me just look for it first.
Okay, so you look for those. Again, we had those in the slides here. It was in the plan. And Janice and I will talk about those. So basically, you've seen these 2 clips, right? You know what I'm talking about?
No, you're going to have to explain it to me.
It was like last week, this reporter was asking the same question of Dr. Fauci, and he was saying, look, what do you mean? When are we turning around? Which peak have we reached? The peak? Which peak are we talking about? It's going to vary depending on region, depending on time frame, depending on community. Just the sort of conversation that you and I were having a minute ago.
And testing.
And the amount of testing. And Dr. Redfield, the head of the CDC, was having a similar type of conversation. He simplified it, and I think when he simplified it, he put it in the words that most people are expecting. They're expecting one curve, and you peak at that curve, and at some point you have less cases than you had the day before, less cases than you had the week before, less cases, etc. Right. And he said that obviously has not happened yet. But again, it's more complicated than that.
Right.
That's what these two clips show. Now, so what remains to be done? We've got social distancing. That's going to continue to happen, and
which we now call physical distancing. And that distance has grown. The CDC recommendation from 6 feet.
6 feet to
13, maybe.
So, have you seen some of the pictures in some of the workplaces that we're talking about, like meat packing plants and things like that?
Well, I mean, I know the grocery stores have tapes outside for people waiting to get in.
In some of the meatpacking plants, you have this level of distance, and so their version of countermeasure was to put a plastic shield up right here. That's obviously not. I mean, they were okay with that a couple of weeks ago, but I think that helps me realize that there's probably going to be some unsettling of the supply side chain for meat. For people, those of us who eat meat.
Well, there's already articles that Tyson and Smithfield have begun closing.
Right, and that picture was a Tyson plant.
But again, I think that is, in that plant and everywhere else, even in our own homes, that's open. People are interpreting it the way that is most functional for them. So in the plant, it was based on productivity.
We've got 330 million people who not only struggled getting their head around what it meant to start social distancing. Now we've got to figure out each component of our lifestyle.
Right.
So again, if we think it took a while for people to get their head around, I really do need to do physical distancing. Now we start thinking about how often do I wash my hands? What does hand washing look like? I've been working elbow to elbow in this meatpacking plant for 20 years with the guy next to me. Now we're going to have to figure out how to do something different. I can tell you,
it's hard to retool a plant.
It is hard to retool a plant. The employer that I'm working with right now is mostly financial. And they're looking at all of the complicating factors that go into this and saying, dang, this is not going to be easy.
Mhm.
This is going to become very complicated. Any comments about the federal versus state coalitions back and forth about when and how we open up? Some of the political.
I think we have a
stuff about
topic on that next week.
Okay. So anything you want to cover on these bullets?
No, there's been some regional grouping, you know, coalitions, but this is all changing day to day.
Yeah. To that point here, for states with increasing cases, it's too soon. Well, let's just run through these real quick. Several states began the first steps in forming coalitions in terms of saying, we're not going to follow this just by politics. We're going to get science input on when and how we open up. Employers, by the way, are only considering their jurisdictions where they're located as part of the equation. They also have to think about, just like I brought up with the Tyson case, do they have, what sort of social distance or physical distancing do they have available within the environment? They also have to think about what sort of PPE, personal protective equipment, do we have for the individuals?
And the factory is just one step. Then it goes to a warehouse where it's handled, you know, you have to have regulations on how it's handled there, how the workers interact there, and then it goes to retail.
And the employer that I'm working with is like many of them. It's got locations all over the place. This is not going to be a Chicago. The Chicago site's going to have their issues. New York site's going to have their issues. We've got sites all over the country that we have to deal with. So there's the statement in this bullet: for states with increasing cases, it's too soon. Yeah, well, for some cases that don't have a lot of, for some cases it may not be too soon. And for some states, they may not hit a significant peak coming out of the blocks. But I think that remains to be seen.
And as that bottom photo showed, testing is imperative for that reopening.
Yeah. You want to talk about testing for a second?
Go ahead.
Well, I'm going to ask you if you will, because I got the wrong deck up here and I'm trying to find the one that we redid.
I think we should start taking questions on this maybe while you're looking for that other deck.
Okay. Why don't we do that?
I got the videos, Doc. They want me to play those?
Okay, go ahead and do that, Carl. Carl, are you playing the video?
Yes, Doc.
Well, Carl, I can't hear it, so there's no way I know when it's done.
Okay, I'll let you know.
Here's the revised deck. Put it in our shared drive. Yeah, I'm going to go and talk about this. PPE. You may want to just stay in here for a second. It is, it's right here. Thermoscan. Okay.
from getting there?
You know, we're rapidly approaching, if you look several weeks to a month ago, the number of tests were out there right now. I believe the last number that we spoke about the day before yesterday or today was close to or even at or beyond 3 million tests. That's really far, far greater than what we were a couple of weeks ago. Right now, they're developing the capability of even escalating and accelerating that even more, so that we'd be able to have a significant number in that measured in the millions of tests each week.
What do we know about whether you do develop immunity to coronavirus? I'm sure they have found the virus as being reactivated in a number of patients they thought had been cured. What do you think about that?
We don't know how common that is. It's likely an uncommon event, and we would have a public.
So, Carl, is it done?
Yes, Doc. Go ahead.
So I was because of our technical challenges today, and again, please thank you for being patient with us for dealing with those. Hopefully, we'll have these cleaned up by tomorrow. What I remember of those two clips is, again, the statement that it's not going to be business as usual, and it's not going to be a simple, okay, we're over the hump now, it's time to get open back up. It's going to be a new world, a new focus, a new way of dealing with things. It's going to be complicated compared to what we've done in the past. We'll be looking at different types of PPE, N95 masks. The supply for those has to be cleaned up. Surgical masks, the supply for those has to be cleaned up. Each one of these components has its own supply issue. We'll also be looking at things like distancing in the workplace. Janice and I just referred to that with the meatpacking plants. Some places are going to have some ability for distancing. Some places it's going to be a challenge. And again, some people will be wearing and have appropriate PPE, others won't. We're also going to have to start looking as employers and as a culture at, okay, what's appropriate for us in terms of return to work? I don't think 70-year-olds, even some 60-year-olds with significant high blood pressure, prediabetes, other comorbidities are going to be as quick to get back into the workplace as younger people without some of these challenges. So again, these sort of things were not things that we thought about very much prior to COVID-19. This picture is a very interesting one. This is in China, where the fellow's taking a QR code picture. He's having to take a QR code picture in order to get some mass transit. I think this is a subway in China. Now, what does that mean and what's going on? So China now has some software where they're tracking people, and they've got red, yellow, and green in terms of their risk for COVID and their risk on whether or not they might be susceptible and whether or not they might transmit this risk. So, and as you might imagine, what they're doing is they're putting that together with things like, can people access mass transit? So as is typical with China, they've developed a countermeasure, and then it's already starting to raise eyebrows on, wait a minute, there's going to be some significant impact on personal freedoms. And yes, there will be. There's going to be a whole new set of issues regarding personal freedoms, freedom with how we manage getting the economies geared back up. We mentioned some of the local environmental issues. If a local employer, if you're an individual looking at getting back to work, a couple of other things that you'll be thinking about is that hospital system, does it have capacity? If not, then that's something else we're going to have to be thinking about. Here are a couple of very interesting things to be thinking about. Right now, you've seen many pictures and videos where you've got a forehead thermometer. Look to see that forehead thermometer used a lot more, but also look to see it actually replaced with what we call a handheld thermographic camera. Now, what's the difference? Well, the thermometer just shows a temperature, and it doesn't store anything, and it has to be very close to the person, like, you know, a few inches. And it, you know, it can do a few dozen people, maybe at most, per minute. A handheld thermographic camera, which we're already taking a look at for some of our employers, you're going to start seeing checkpoints, security checkpoints, when you come into a workplace that look like these pictures on the right, and you're going to have a very, very different type of system. This thermographic camera is going to be set on like a tripod or other system. It will be real time. It's not several dozen, you know, a dozen per minute. It can do as many as you want per minute. It will store information on the temperature of the individual. People will be walking through that in terms of lines. You can probably expect that whenever airports get geared back up. So again, we're starting to look at different types of technology, which are going to be very complicated compared to the simple days of 6 months ago. This group, I think, I can't remember the name of the technology, Henner or something. They're already working with the NFL and with, what's the name of the group? Oh, I think Hospital Corporation of America. So a lot of interesting things going on, and they all boil back to, have we reached the peak yet? And are we going back out to start up the economy? Like I said, not quite as simple a question as many of us might have thought. So let's see if we end up having, well, Carl, I can't see if there are any comments because I came in as a guest. So you're going to have to read the questions out to me. Wait a minute. Let me see. Yep. Okay. So, okay. We lost audio for a while. Not sure how many people are on. We got Joe. I know that Joe tried to call me a few minutes ago. I wondered if you were calling me to try to tell me. Okay. Anyhow, again, partly so much for the challenges with the technology today. Nancy DeBrozic, hello from Florida, where the governor is getting ready to open business. Robert Simpson, hello. Couldn't we get another governor? Greetings from Dennis Williamson. Hello, Dr. Brewer. Good morning. Sandy Crane, good morning from Missouri. David Drake, same for the DeWine in Ohio. Starting May 1st. We have good data with the people doing their part. Yeah, so thanks for noticing that, Carl. Since I've had to come in as a visitor, I can't click on what's showing. Main Shire. Shouldn't we take China's numbers out of the equation since their government's reporting can't be trusted? Well, as if, what can be trusted? Again, that's the whole point. You have to consider each piece of data by its source. Joseph Page, why did you choose the specific ACE inhibitor that you use? Thanks. Well, I originally chose a different one. I originally chose Ramipril, but we had a problem with the supply for Ramipril. After multiple issues with that, I talked with my pharmacist, and my pharmacist recommended Benazepril. And then actually I was getting to a point where I needed to add a calcium channel blocker. So there's a good combination of Benazepril and amlodipine. I can't remember the brand name. So Z50, Z6. And yesterday we had crowds demonstrating public defiance of stay at home in Wisconsin. Carl, are you still there? Thank you. John Taylor, it's a hockey stick analogy, not hockey puck. I don't remember saying hockey puck. If I did, I apologize. But I've always meant hockey stick. Jerry West, models have been based upon guesses. If there's a lack of data, the model assumptions can vary widely. If we do not know the correct reproductive index, the models can be exponentially wrong. And again, yes, I think we've seen that. Bob Weiss, North Georgia Mountains, good morning. Heidenique, until the cases slow to 1 or 2 cases a day, then we'll know the peak every state will be different. Heidenique, we need to stress if you feel sick, stay home and ask others to bring you food if needed. Heidenique, no audio. Joe Riley, no audio. I am guessing and hoping at this point, Carl, that we've got audio going.
Yeah, we got audio.
Okay, thank you. David Drake, does the 1 or 2 cases a day standard apply for the influenza as well? Then we'll never go back to work on the standard for influenza alone. I'm not sure, David, where the 1 or 2 cases is coming from. I've seen a couple of comments on that in the comments section here, but I think that's totally unrealistic for us to expect to get to 1 or 2 cases only. Kathy Jensen Budahiri, no sound, no audio, no audio. Got it. And I think Carl has fixed that. We can hear you forward, but not the video. Yeah, I couldn't hear the video either. John Taylor, joke. Well, here we go. Let's skip on down here. Looking at Mr. Dave, looking at Florida Department of Health website, we had peak new cases 2 weeks ago and peak deaths more than a week ago. IHME, that's the University of Washington group, is not presenting the truth. New York and New Jersey should not reopen for 3 months. Yes, I think there's going to be a whole lot of debate on who should reopen, when they should reopen. And I'm really skeptical regarding cutting a swath as wide as saying an entire state needs to reopen. I think that's part of the recurring conversation that we're having. Understood you couldn't hear the video. Again, I apologize for the technical challenges we've had. David Drake, well, David Drake. IHME is updating modeling guide only, not a law to make final decisions on. The WH is having each state and governor make decisions based on data, not time. Heidenique, another name is thermal imaging camera. I have one here. Very good. I thought that was the term I used. Maybe I didn't. I've got so many things flying around with these tech challenges that maybe I misread it. Karen Black, would infrared thermometer for HVAC work for people? It's a good question. I don't know. Robert Simpson, this reopening of the country is going to be a hot mess. No question. Amazon, hi Doc and Janice. You discussed Hong Kong and its response. South Korea seemed to have a better response. How about a comparison of their efforts, and maybe the U.S. can copy their response? Well, I think the U.S. has learned what they're going to learn from people, and we'll all continue to learn from each other. One of the things, I listened to different videos and read all night long last night, and one of the things that continues to strike me is this continued human factors thing. People want to blame leaders. Leaders want to blame other leaders. People get mad at, the public gets mad at one set of leaders and protects the other set of leaders. And one of the biggest issues is the public itself. And a lot of the leaders seem to be very reticent, and I understand why. If you're a politician, you don't want to call members of the public out, maybe your voters. But you see some of that now too. Bottom line is we're all making mistakes, we're all learning, and we could be doing much worse. Jackie Shaheen, how confident are you with PCR when there is no gold standard? Well, Jackie, that's a great question. The bottom line is, tell me where there is a gold standard in medical testing. There isn't one. There's no such thing as a, quote, gold standard in medical testing. Every test that has been developed has its false positive rate, false negative rate, and it gets even more complicated. You realize that the predictive value of a positive rate actually changes depending on the portion of positives in the population being tested. So for example, if there are always some false positives and false negatives, if you test a patient group that has nothing but negatives, it's going to have a few false positives. It's not going to have any false negatives. On the other hand, if you test a group that has nothing but positives, it's going to have a few false negatives, but it's not going to have any false positives. So just to help you think through the logic on that, rating testing gets very complicated. There's another space that I think is very practical, a very practical consideration. And you heard Dr. Burke say this a couple of times, and I think she's right. You hear things like, oh, there's a 30% false negative, what was it, 30% false negative rate in the antibodies test. That just does not fit in terms of what we're seeing with the rest of the data that's coming out there. If the antibody tests were showing a reliable 30% false negative, you wouldn't be seeing the transmission numbers that we're seeing. Fennell Hicks. I just don't understand, Fennell Hicks, Carl. I just don't understand how we talk about getting back to business and we still don't have tests. Maybe I'm missing something. No, I think the rest of us are missing something, Fennell. Testing is becoming more and more available, and I think that's what's going on. There's an implied assumption here that that curve will continue to ramp up, and I think that's true. I think over the next few weeks, you're going to get more and more and more testing available. 3 weeks ago, a month ago, you just couldn't get them anywhere. Now they're starting to happen, and again, 3 weeks, a month from now, I think you're going to see a whole different ball game in this area. Well, guys, it's been a challenging show. I really appreciate the patience you've shown with us. Just a couple of explanatory comments. For some reason, when my Google Chrome came back up today, it didn't recognize me at all. I had to re-register back in. So it didn't register me for StreamYard. It didn't register me. So StreamYard didn't recognize me. So then we had to go back into StreamYard and get it to send me an email. It didn't recognize. I had to re-register on my email. Meanwhile, we had some changes on the deck that Chris was working on. He ended up sending them back through the Google Drive, which required us to go back in. So I'm in as a visitor trying to pull slides up off of the Google Drive. It's just, and again, as a visitor on StreamYard. So as you see, that's created a lot of our challenges today. Hopefully we'll get a lot of those worked out by tomorrow. Thank you so much for your interest.